A warm welcome to this update, and we're going to be focusing mostly on the United States in this particular video. Now, cases in the United States are rapidly approaching 3.5 million, and especially in some southern states, cases are increasing dramatically. And we did look at some specific numbers on this yesterday. But just before we start, I'm just going to give you a graphic that's giving the general idea of where the United States is going at the moment. Then we'll try and look at some of the thinking behind it rather than bombarding us with too many figures today. So let's look at this first. So this is the overall numbers of new cases, and this is a linear scale. So the number of new cases in the United States is above 60,000 per day. This is a 7-day rolling average, so it is going to vary a little bit, but this is a steep increase, there's no question about it. Other countries we've been following, India is also steeply increasing. The trend is not good, and Brazil, to be honest, I've had difficulty getting accurate data from Brazil. I know in Brazil they were changing the way that they calculate their figures, so I'm not sure we can really put too much onto the Brazilian figures. But we know from reports on the ground that things are getting worse there. But focusing mostly today on the United States. So the news this morning, NBC News said 41 states with rising cases. Yesterday, I think I worked it out at slightly more than that. I think I worked it out at about 46 states with rising cases. But the vast majority of cases, unfortunately, or the vast majority of states have increasing cases at the moment. Now, this is surprising and discomforting. The delay in testing. Now, I've watched quite a few news reports on this just this morning, and there's really significant delays in testing in quite a few parts of the states. Now, really, you would have expected the authorities to have this sorted out by now, but it doesn't seem to have happened. So hearing of 5, 6, 7-day delays in getting test results back is not uncommon. And of course, this means that if we haven't got definitive test results, how can you trace and track and isolate contacts? It makes the whole thing really rather difficult. And very long delays and queues, people waiting to get tested. So testing actually a bit of a problem when I really thought it would have been sorted out by now. People are getting sicker and outbreaks are getting bigger because of this lack of testing. That is the outcome. Because you can't test, people will get sicker, more people will get infected, you don't know who to isolate, and the outbreaks gets bigger. Testing is absolutely pivotal. And without good testing, you really are fighting with one hand tied behind your back, which is unfortunately the situation in many areas. So the contact tracers can't do their job if they don't know who is positive. So the contact tracers who will follow up the people that have become the contacts of the people that have tested positive so they can isolate, well, they can't do the job because they don't know who's tested positive. So not a good situation. But then the discomfort that many people in the States are feeling, and I feel, is professional athletes seem to have no problem getting tested at all. I mean, bully for them. But, you know, what about everyone else? Of course, there's big money involved here, isn't there? Big money involved. One NBA basketball player said he'd been tested 20 times in Florida, whereas other people struggle to get one test. This inequality makes me feel very uncomfortable, and I'm sure it makes a lot of you feel very uncomfortable. And that's putting it mildly. I'm sure it's making a lot of people angry. Now, on testing on the slightly more positive note, Arizona State University is developing a saliva test. Now, I'm going to follow this up as soon as I get time and give you more information on it. But rather than doing 2,000 swab tests, the oropharyngeal, nasopharyngeal swabs that people traditionally have been doing, they're now testing saliva. And they've able to increase their testing from 2,000 a day up to 16,000 a day. So a very impressive, dramatic increase from Arizona State. Well done. I haven't got the figures on the accuracy of that yet. I haven't seen a publication on that yet. So no doubt they're working on a publication. But this is potentially really quite revolutionary. So if we could increase the amount of tests by a factor of 8 that are being done all around the world, that would transform this pandemic. So a simple, ideally mobile, low-skill, saliva-based test would just be wonderful. And if Arizona State are going to supply that, and let's hope if they do, they make it freely available to the world, that's got the potential to save, globally, millions of lives. It's potentially transformative. More on that as soon as I can read whatever publications they come up with. Or if someone from Arizona State wants to contact me, I would be delighted to know more about that. But sounds very promising indeed. Now, individual states, Florida. Well, it's just an exponential increase in cases, isn't it? The more cases there are, the faster the rate of growth. So the whole thing is an accelerating acceleration. 15,000 cases on Sunday, 12,500 new cases on Monday. This real figure is probably a bit lower because the Monday figures often tend to be a bit low because of reporting difficulties over the weekend. Businesses are open as usual, so I've heard. Now, Carlo Gimenez, he's one of the regional mayors, and he said the reason for the pandemic is us. Okay? Good to see a politician taking responsibility. Not the reason for the pandemic is you. The reason for the pandemic is us. For good or bad, we have to move forward on this together. So quite a refreshing thing to hear a politician say, I must say. Don't know this particular mayor at all, but I agree with what he said there. And he goes on to say we need to change behaviour, for sure. Now, young people have been testing positive after COVID parties. Now, this is simply unbelievable. When I first heard this, I didn't really believe it. But there seems to be in various parts of the states and Florida, the news outlets are reporting this, that young people have got together for COVID parties, deliberately breaching social distancing. There seems to be two lines of thinking behind this. One is that they're going to run this randomised controlled trial to prove that this whole thing is a fake. Now, if you want to do that, there are ways to do that. The way you're doing it is not very scientific, to prove this is a fake. And there was a really moving interview on the news where I think it was a 30-year-old looked at his nurse and he said, "I think I made a mistake. This isn't a fake. This is real." And that particular person died. So again, increasing cases of young people dying. And this may be because they've got much higher viral loads. If you get a higher viral load, the infection can go straight down and cause pneumonia pretty well straight off with a higher viral load. The evidence for that isn't unequivocal yet, but it does seem to make a lot of sense. So people that have deliberately tried to get themselves infected with a high viral load could get more severe illness more quickly. So there's been these COVID parties to deliberately spread the infection. I mean, it really is hard to believe. And now in Florida, 7 hospitals are at capacity. So what happens when the next patient arrives if the hospitals are at capacity? We could actually be in the situation where, well, we probably are now indeed in some areas in the situation where people are dying through lack of basic medical care. We know this has happened in various countries around the world. Tragically, we've seen videos of relatives scrambling to get oxygen from the back of a lorry because the loved ones were dying of lack of oxygen in different parts of the world. But the idea that people, you can see I'm struggling with credulity here, the idea that people would deliberately make this worse is just unbelievable. And make no mistake, people will die. People will die, are dying now as a result of this type of behaviour. I really, really do struggle to understand it and can't condemn it strongly enough. Just incredible. Hard to believe, but there's multiple reports. California. Again, California, great increases in cases. We saw the website last week, yesterday rather, where you can hover over your state and look at the numbers. Do check that out. It's a CDC website. So California basically rolling back everything. Basically everything indoors is closed down. Bars, indoor dining, churches, anything that's indoors has had to be suspended, unfortunately, again in California because of the rapid community spread. Now, again, on the news this morning, I saw a really sad video. There was a guy, I think he was running a gym or a fitness centre, and he's saying businesses will be closed, good people will be unemployed because people would not wear a mask. Again, the sheer incredulity of this. So the absolute incredulity of people attending COVID parties, thereby resulting in people being unemployed, incomes not available to families with young children. It's just terrible because people want to go to parties. And then this chap saying, basically people are going to be unemployed because people would not wear a mask. The effects on real people's lives are devastating, both in terms of the virus itself, the morbidity and mortality of the virus, and the economic impacts that are instigated out of necessity to slow the spread of this, because amazingly some people have been deliberately spreading it. It's just incredible. Now, Arizona, just to give an example, and we could have used California as an example as well. 19% in Arizona are testing positive. Now, a lot of the people that are going for testing are symptomatic, but a lot are asymptomatic as well. They're going because they're concerned. But out of all the people in Arizona that are reporting for testing, basically almost 1 in 5 are testing positive. And what this means is there is an awful lot of community spread of COVID-19 in Arizona and these other states, because this is a very high positivity testing rate. And of course, these people that are testing positive, many of them will have already spread the virus onto other people. So it really is concerning that we're going to see, inevitably, we're going to see so much more growth in the United States over the next few weeks. This is not going to turn around in a few weeks like the Admiral said yesterday. It's going to, I'm afraid this is going to be carrying on for some weeks or months to come. Now, I'm going to leave the last words today to Dr. Fauci. Now, I've been doing a bit of research into Dr. Fauci. Whether you like him or not, he's a pretty amazing academic. He's got like about 1,300 publications. Now, I wouldn't have thought that was possible. I mean, in my entire academic career, I think I've bashed out about 50. I know only half a dozen or not even that, probably 3 or 4 or 5 of those were primary source research, which is fairly typical. But he's been involved, about some reports say 1,300, which is quite incredible. I can't believe he's written all them himself, but he's a very established researcher, is the point. Anyway, I want to judge him entirely on what he's saying at the moment. So these are a few things I've put together that he's recently been saying. Now, these are from different sources, so it's hard to reference them all, but it's my best interpretation of what he's been saying. We haven't even begun to see the end of this yet. So, in other words, we're still at the beginning. This is going to carry on until 70% of people are immune to the virus. And we're nowhere near that yet. So basically, we're still at the start of this pandemic. We've been saying that. It's good to see that he's confirming that. We're still in the first phase, basically. Now, he's been, for 36 years, he's been director of the National Institute of Allergy and Infectious Diseases. And he's currently heading up the vaccine program in the States. So Dr. Fauci seems to think that there could be a vaccine available by the end of 2020. I think he's being optimistic, but let's hope he's right. Something else he said, I don't think it's an exaggeration to say we have a serious ongoing problem right now as we speak. Well, yeah, that's a pretty short debate, but again, good to see him confirm that. Serious, ongoing. This is not going away anytime soon, I am afraid. What worries me is the slope of the curve. It's going up, and he says it still looks like it's exponential. In other words, the rate of acceleration is accelerating. The rate of increase is increasing with the total number of people infected. Many states started reopening up before their cases got down to a baseline level. Right. So what he's saying here is that if states had stayed closed down until the number of cases were really low, then any new cases could be easily tracked and traced, and the numbers could have been kept right down. But because states opened up too early, they didn't get the base low enough. Now, most European countries, while there's an ongoing trickle of cases, and as we saw in the previous video, some intimation of increases in the UK, most European countries are actually keeping the cases fairly low at the moment because they kept the lockdown in place till they got the numbers well down. But Dr. Fauci is saying that wasn't necessarily the case in the States. Many states opened up before their cases got down to a baseline level where new cases could be easily tracked. So, of course, the fewer cases you have, the easier you can track and trace the cases that you do get, and therefore it's easier to target your resources and isolate people. So basically he's saying that most states simply did not get the numbers down enough before they started reopening. And he's being quite polite. A lot of places, it seems to me, just ignored the problem and hoped it would go away. I think we have to realise that some states jumped ahead of themselves. Other states did it correctly. Yeah, that's what Dr. Fauci is saying. That's what he said there. The citizens did not listen to the guidelines, and they decided they were going to stay in bars and go to congregations of crowds and celebrations. That's what Dr. Fauci said. So it's not just the top-down political control. The citizens, still can't say it. The citizens. Many people were not complying with the instructions. That's the serious point. Many were, of course. But big enough numbers were not to cause this widespread community spread. Now, he says the US has always valued individual rights, of course. Excellent. But this attitude could make it harder to tackle the pandemic. I must say I've seen interviews of people in the States, and not just the States, anywhere. Basically, I'm going to do what I'm going to do. I'm going to do what I want to do. And in parentheses, you could say stuff everyone else. So this individual attitude it should not be the one that's being stressed at the moment. Yes, we all believe in individual rights. Of course, we're liberal democracies. But there is a time for corporate collective action, as in war. And this is such a time. Now, he also said there's been a movement against science and authority, both concerning. You see, science, when it's done properly, is an empirical investigation to understand the nature of reality. And it's by its publication and its peer review process, it's a self-correcting process. So when it's done right, science is a path to truth. But there's a movement against science at the moment. Now, partly this is because there's been some crummy science out there. But the point is, that is now being corrected because science is a self-correcting process. But this has sort of mitigated a public mood, if you like, amongst sections of the public, not everyone, of course, against science and against authority. So, again, we could talk about reasons for this. It's beyond the scope of this podcast, but he's simply reporting that this is a fact. Dr. Fauci is saying There is a movement against science, there is a movement against authority. That's his perception of the situation. This is very, very problematic right now. You see, right now we need science, we need authority, we need to move together. And if we haven't got it, this is very, very problematic, and I would agree. And he goes as far as saying there's been extreme confusion about the virus. Now, this is partly due to the message. We were talking to Lindsay a couple of days ago, and okay, Canada's not perfect, but she did say there was a consistency of message in Canada. And they are reaping relatively low numbers at the moment as a result of that. Not perfect, there were many things they did wrong, but basically the message, Lindsay reported that as being clear, having carefully observed the situation in Canada all the way through. But there does seem to be more confusion in the United States. So partly the communication, but Dr. Fauci also says, and this is after a long career in infectious diseases and immunology, I've never seen a virus or any pathogen that has such a broad range of manifestations. So path is disease, gen is beginning, a pathogen is anything that begins disease. And he's never seen a virus or any pathogen that has such a broad range of manifestations, from being completely asymptomatic to being a bit ill, to being very ill, to being oxygen dependent for your life, to needing critical care, indeed to dying. Such a wide spectrum, and he's never seen such a virus. So that was interesting. So it's partly learning about the virus that's been part of the process of coming to understand this. And this has caused confusion, and it has caused a degree of mistrust. But science does correct itself as it goes along. So the science now that we have is much more accurate than the science we had 6 months ago. The science we will have in 6 months' time is much more accurate than the science we have now. But really, I don't really see we've got an alternative to a scientific approach. Guessing would be the alternative. Dr. Fauci again, even if it doesn't kill you, even if it doesn't put you in the hospital, it can make you seriously ill. So, strange virus. So it can not affect you, can put you in the hospital, can make you seriously ill. This is interesting, Dr. Fauci said this. I have a reputation, as you probably have figured out, of speaking the truth in all times and not sugarcoating things. That is what I like to hear. I want to know what the truth is. If I look pretty rough one day, I'd rather like to know that rather than people say you look great. Reality orientation. It's what science is. It is the strive to find out that which is in reality. And if he's doing that, that's good. Speaking the truth. We need to speak the truth. That's good. If he does that consistently, he has my admiration. And that may be done, and that may be one of the reasons why I haven't been on television. Okay. It might be one of the reasons why I hasn't been on TV much lately. There you go. So just a few interesting things there. So basically, the southern states are in many cases worse than New York was at the peak in April, and things are accelerating. And if hospitals, again on the news report this morning, someone was saying hospitals are fuller than 100%, if that's possible. So this 4 or 5% of critical patients, 4 or 5% of a big number is a big number. And it's going to make healthcare very challenging. And there are already anecdotal reports of people who could have survived if they received more rapid, more thorough healthcare. And that is only going to get worse over the next few weeks. Feel bad about saying it. It sounds unduly pessimistic, but that is the sort of, to me, what's the scientific appraisal of the situation we have at the moment. And also what this means is places with poorer health facilities that are going to get this kind of exponential growth in the next month. The case fatality rate in those areas, unfortunately, will be even higher. And as we saw on the previous video about preparation for the UK, the time to prepare to mitigate this is now.